Good afternoon to all of you. It's a great pleasure to be here with you. And first of all, I want to thank Professor Praveen Potale and all the organizing committee for having invited me here. It's an honor. So in few seconds, I'm going to share with you the role of the hypnotic communication in interventional electrophysiology. And I think that our background is that we have to keep in mind that hypnotic communication may be very effective in the treatment either of the acute or chronic pain, as you may see here in different settings, maybe during labor or also in different surgical procedures, or above all in trying to manage pain due to burns or, for example, in dental setting. But I think that also in cardiology, there are a lot of situations that may benefit from this technique, for example, in electrophysiology, but not only, also in the intensive coronary unit, or also in echocardiography or in the interventional setting. And I will show you some examples, in this case, just for a matter of time, confined to the electrophysiology field. And first of all, I think that we have to know that this technique, of course, as you may expect, is operator dependent and also patient dependent. So you, in this case, need to establish a rapport with the patient, because it's the physician guiding the patient, but it's the patient having the ability. So the success of the procedure, of course, depends on the physician, but not only. It depends also on the patient's ability, in this case, having a sort of pain relief, as you will see. And when you have to use hypnosis facing with another man, you have to see him or her and to feel what he or she is feeling, and to be in touch with the patient, joining with the patient. And in this case, considering the electrophysiological field, I think in every situation, I say that you have to face some trouble. That may be the length of the procedure, the anxiety which is related to the procedure itself, and consequently the pain that the procedure may produce, and above all also the movements that the patient may have on the operative bed. And in this case, for example, just considering the atrial fibrillation ablation, which is, I think, one of the most widely used in the world, considering just some recent reports, you may see here that the mean length of this procedure is about 3 hours. Okay. And in this case, you have also to face with the anxiety very often related to a redo patient, because very often you have to use radiofrequency, which is really effective, but it burns. And burning implies also that during ablation, the patient may have as consequence pain. And this in this case, it's very important to stay still on the bed, because very often we are using some devices, like the Electroatomic mapping system, that needs to have, in this case, the system needs to have some references with some patches on the skin. And in this case, these are some references that you have to combine with some sensor, for example, as in this case, just behind the bed. And you require that the patient has to stay still, completely still on the bed, in order to have a reliable reconstruction of the heart chamber. And for this, very often, at least in Europe, very often we have to use deep sedation or narcosis. And in different countries, the percentage of this methodology is ranging from 20 up to 80% of cases sometimes. And of course, narcosis has the advantage that the patient is still, you have no anxiety, no pain, but on the other hand, you have to use anesthetic drugs with some side effects. You may have some post-procedural discomfort. You may lose the patient interaction without any cough or other esophageal pain that may alert you, and above all, you need a complex setting. I mean, the anesthesiologist and the ventilatory machine. And this is our experience that I want to share with you, that we published in the International Journal of Cardiology and Vasculature last year. And you see that we decided to apply the hypnotic communication for managing procedural analgesia during atrial fibrillation ablation. And for this, we decided to compare head-to-head 70 patients who underwent the procedure under hypnosis as an adjunctive technique versus other 70 patients where we used a conventional analgesic protocol. There was a match into the groups, of course. I think that we can skip. But the results. So you may see here this graphic that implies the starting point here with the pre-procedural score about anxiety. And this is the in-procedural score. And the patient answered this question just at the end of the procedure using a numerical score. And you see that there is a drop in the anxiety during the procedure thanks to the hypnosis. And what about pain? You see that considering that a score which is less than 2 is considered a painless procedure, okay? And you may see here that in 78% in the group A patient who underwent the procedure under hypnosis, 78% had a painless procedure, as you may see here. And what about drugs? I think that this graphic is also impressive because you may see here that in the hypnotic language group, we used the hypnotic communication in adjunctive way just with paracetamol or fentanyl. While if you consider the traditional approach, you may see here that you have to use the propofol sometimes, midazolam, and above all, in 2 cases, 2 patients required narcosis to manage the procedure. And I think this is quite impressive. And last but not least, most of the patients had a reduction in the procedural time per session that you may see here. This is the perceived procedural length, which is less than the real time of more or less 1/3. And considering all these results, all the patient state that this methodology to combine the hypnotic communication with the, let me say, standard analgesic protocol was profitable and excellent in all of them, as you may see here with this graph. So in the last 3 years, our overall success using hypnosis in this setting was 81%. You see here the range of the age of the patient, mostly affected by atrial fibrillation who underwent an atrial fibrillation ablation with a 90% of success, a little less in the SCID implantation, and in the just in the middle for PM experience. I think that these differences may be due also based on the type of the patient, because of course pacemaker patients are older if compared with, for example, the atrial fibrillation patient, and the patient who underwent SCID may have a different disease per session, maybe with a higher level of anxiety that may sometimes reduce a little bit our percentage of success. Of course, we have to exclude the psychotic disorder and cognitive impairment. Just to share the hypnotic workflow, first of all, you have to lower the inappropriate anxiety, and you have to define the aim with the patient. Then you have to focus the patient attention in order to dissociate him from the surrounding. Then you have to give suggestions, and then you have to validate the hypnotic status, maybe just evaluating response to pain, as in this case, for example. And then during the procedure, you have to reinforce and consolidate the status. And above all, and you will see in a few seconds what I mean, you may give to the patient the capability to induce by themselves a self-hypnosis in the future. This is just one example of a patient who underwent an atrial fibrillation ablation. He's on the bed without any adjunctive drugs. I will try to translate in English what I'm saying to the patient in a few seconds.
Quindi mi chiudi gli occhi, così mi tieni gli occhi chiusi, così ti puoi
I'm asking
concentrare
the patient
bene
to
sulle
close
cose
the eyes
che ti dico.
in order
Allora,
to
chiudi
focus
pure
the
gli occhi,
attention on his breath.
adesso ti devi concentrare molto attentamente sul tuo respiro. Quindi proprio focalizza tutta la tua attenzione sul tuo
I'm
respiro,
asking
bravissimo.
to focus all the attention
Così
on the
puoi
breath.
sentire il torace che si
And
espande,
I'm trying to
adesso che si abbassa,
give him a feeling about
sentire l'aria
suggestion
che
about
spinge nella
the
pancia,
expansion of the thorax during the breath.
che esce dalle narici,
And you will see here the face of the patient.
adesso entra dalle narici, non vai e vieni, con
in
il
2 seconds,
respiro
of
che
course, I
va e
have to
viene
skip
come
part
fossero
of
le
the
onde.
procedure.
Potrai percepire
And
ancora
just to
il contatto
moving
del
to
mio dito sul
evaluate
tuo braccio destro,
the
e
perception
potrai
of
muovere
pain of the
l'indice della
patient
mano
without any
destra
drugs.
per confermare di averlo sentito.
Also, the
Molto
patient
bravo.
is able to feel my touch, and now I'm punching him with the
Molto
needle
bravo.
here, and you see no
Molto bravo.
feeling.
E più le sensazioni esterne aumentano, più il tuo controllo aumenta, più tu vai in profondità, sempre più lontano, sempre più distaccato. Molto bene.
I'm pushing him
Così
deeper
che
and
niente
deeper
possa arrivare a disturbare, nessuna sensazione.
in order that any sensation
Molto
will
bravo.
not be able to disturb him. Now this noise is because I'm ablating, applying radio frequency. You see the patient is still without any adjunctive anesthesia. After more or less 1 hour, I'm closing the access, the femoral access here, and you see any movement. No movement, no feeling. Okay, and then I'm trying to reorientate the patient. I'm asking him that if he had any pain. He told me not. He was feeling, but without any pain.
Ma vuoi dircelo? Certo, siccome mi piace andare in moto, allora ho immaginato
He told me that during the procedure, he was riding his motorcycle looking at landscape. Okay? And we also performed in very few cases, this is a preliminary experience, with a laser, which is much more painful. And you see only paracetamol and fentanyl, and that's it. Just to mention 2 cases of laser pulmonary vein ablation. And the mean time required to induce the hypnotic status is more or less ranging from 3 up to 5 minutes. And the gift that you may give to the patient is the anchor. So you can anchor the patient to a self-hypnosis, and I will show you here. With the same patient, I'm talking to him, just saying that now he is able to range loose using this, let me say, joining these 2 fingers is such a button, and you see that with the self-made, the patient is again under hypnosis, and I'm asking to the patient that he can decide and to choose part of his body where do not have any feeling. He is choosing the leg, the right leg, and you will see what I'm going to do. I'm puncturing him without any movement, any feeling. Now I'm asking to choose another part of his body, You choose the belly here and puncturing him, and you see complete control. I think this is really important because in this case, the patient may use this technique in the future to manage pain, to manage anxiety, to be much more controlled in his daily life activity. And in this case, because you have to consider that the hypnotic language may provide a new language pattern that may address beliefs, time orientation, perception, and above all also spiritual methods and state of mind. And in this case, despite from the outside, the person seems to be asleep because the eyes are closed, and it's anyway, he seems to be still. From the inside, the mind of the patient is really much more alert and awake and much more in control and expansive than in normal status. And in fact, if you see here the line separating conscious and unconscious, this is the arousal status, this is the crepuscular and the pre-sleep status. The hypnotic status is not here, it's just on the opposite, is here. So you have an hyperactive sensory in a complete high level of control. And it's for this that you need to be conscious and do not use, for example, benzodiazepine that may make you lose control. And you may also use, for example, as in this case, a sort of breath storm. During the ablation procedure, very often you may have the breath that may affect the procedure. And you may see here with deep breath, this is the graphic showing the breath, the amplitude of the breath. And in very selected cases, in critical part of site, for example, just close to the normal conduction system, you need, before to ablate, to ask the patient, as you may see here, to control the breath, to shorten the breath, as you may see here. And in a few seconds, it's becoming red at this point because we are ablating, and you see the patient is able to maintain the complete control on the breath, just allowing us to stabilize the movement of the catheter, being much more precise during the ablation. And this control may last for 1 minute, the time required to ablate this spot. And just moving toward the intervention, for example, pacemaker, you have to consider that you have to make a tissue dissection, and also is much more close to a surgical intervention than the ablation procedure. And you see here, for example, just to sharing a micro implant, this is a pacemaker here, and you need a 27 French introducer that has to be introduced through the femoral vein. And you see here that you have to approach then the right atrium, then to use this long sheet to position the micra here in the ventricle. And this is an example of a patient who underwent this kind of procedure, and using another technique, which is not focusing the attention on his breath, but just following my finger with his eyes here in this way. And in a few seconds, you will see that the patient will close the eyes, being already in the hypnotic status. And suggesting the patient that the eyelids are coming heavier and heavier. And now I'm pushing this introducer into the femoral vein. You see, this is a flutter of the eyes, which is a sign of hypnotic status, without any movement, any other feeling. Of course, I have to skip the procedure, but the patient stay just still on the bed, as in this way, and just reorientating the patient.
2, 3.
And 3, the patient will open the eyes.
Buongiorno Luigi. Stiamo riprendendo, poi vi spiego. Come è andata? Bene, è stato molto bravo, Luigi. Molto bravo.
I'm asking the patient.
Come sta adesso? Come si sente? Benissimo.
I'm asking the patient where he was.
Immaginare qualcosa.
So the patient doing the procedure imagined to be in the mountain just looking for mushrooms, okay? And you see the smile on his face. And also in other setting, maybe the traditional pacemaker, also the SICD, as you may see here. We published the first case in the world of an SICD implanted using the hypnotic communication in a patient with the Brugada syndrome in the heart rhythm case report at the end of the last year. And this is the patient, you see, again, I'm asking to the patient to close the eyes and focusing on his breath. Of course, I'm just validating the status, just functioning the patient without any reaction. And just preparing the pocket here and look at the patient. Just only a little bit of local anesthesia here and very few dose of fentanyl, that's it, during the whole procedure. You see? No reaction. Then I'm just tunneling here, and you will see for a while just the patient will squeeze the eyes for 1 second, and this was the only movement, like here, the only movement that the patient had during the entire procedure. Without any local anesthesia here, just on the pocket. No local anesthesia in this part. From tunneling. The patient had a previous implantation with an infection, and we had to eliminate the previous ICD, and then we have to move to implant an SICD. You see no reaction. The second tunnel here, just in the parasternal line. I'm pushing, no reaction. And in a few seconds, you will see that I will give suggestions for the post-hypnotic analgesia. And I made a mistake at that time because I skipped to give suggestion about the left arm that stayed open for the entire procedure here. So I'm giving the suggestion, trying to produce a focus of analgesia all along the side where we made the implant.
Completamente insensibile, come quando il
suggesting an insensitivity here,
incapace di provare nessun tipo di sensazione.
For the next day.
Molto bene, questo ti rimarrà fino a domani, una completa insensibilità.
I am suggesting to the patient that he will have a complete anesthesia along all these sides for 1 day.
Molto bene. I'm
encouraging the patient, as I mentioned before, giving the suggestion that he will be to range it by himself, just using this sign as a button, to be pressed to induce by himself the status, the hypnotic status.
Io tra poco conterò fino a 3, man mano che conterò tu ritornerai a orientarti a qui adesso, al mio 3 potrai aprire gli occhi, avendo questo pieno senso di benessere, di grande capacità di affallimento, mantenendo questa completa insensibilità, che ogni fastidio non possa arrivare in tutte le parti che ti ho detto, sul torace, sullo sterno, come ti ho spiegato, completa insensibilità con senso di benessere fino a domani. 1, 2, 3. Eccoci qua, abbiamo finito.
patient is smiling.
Come ti senti adesso?
So he's telling me that he has no pain. The only is that the left arm was heavy. And because I forgot to give suggestion about the left arm during the focus on analgesia. And this is the proof of the power of this technique. And there are some meta-analyses that prove that most of the patients benefited from this technique. And this is a meta-analysis that evaluated 10 studies, more than 1,000 patients. And you see in favor of the treatment, as you may see here. And there was a reduction in the consumption of pain medication between 21 up to 86% of the patient. So just to conclude, the trust to continue is this. There are 6 phases of patient just at the end of an ablation procedure, and please take a look to their faces. Just when I reorientate them, all of them are smiling. They finished the procedure smiling. Okay? Younger or older, they are smiling. I think this is really impressive. And the last slide is that using words coming from Maya Angelou, I think that we can say that we can learn that people can forget what you said. People can also forget what we have done, but people will never forget how you made them feel. And so I would like to thank you for your attention, and to thank also all my co-workers that support me in my daily practice. Thank you for your attention.